coming out of dental school, it's a bit of a scary time, what the next step is, where you're gonna go.
That's why I chose to do a residency. I needed to learn more, to do new things that were gonna make me more marketable when I went out into the workforce.
The Cleveland Clinic Mercy Hospital General Practice Residency Program. It's a 1-year residency with an optional second year for chief.
The goal of the program is to give an intense multi-specialty and general dental experience. They rotate through 3 interdisciplinary medical departments: the emergency department, anesthesiology, and internal medicine.
Also, we have dental specialties such as oral surgery, periodontics, endodontics, and pediatric dentistry.
We have a curriculum for practice management. We have guest speakers from banks, insurance companies that help them on their pathway. So it's a full curriculum not only for dentistry but also practice management as well. We have a comprehensive dental clinic facility offering everything from pediatrics to geriatrics. And they also gain operating room experience. We take special needs patients to the operating room and in a 4 or 5 hour slot do complete rehabilitative dentistry.
We do a full exam, x-rays, all the treatment there. And that is one of the most fulfilling parts of this residency. To see how we can really change their smile, get them out of pain, make them feel more comfortable.
Being part of the hospital system, we see inpatients, we see people from the emergency room.
You're on call, which is not something that you do everywhere. And you learn so much. We get calls from the emergency room pretty much every day. It was something I wanted to learn how to deal with at pace too, because dentistry is a quick moving profession.
We've invested a lot of time and money into trying to create the program that will train the future of dentistry. We've incorporated a lot of new technology with 3D scanners, 3D printers, CBCT, digital x-rays.
The teaching faculty is both volunteer and specialty. They actually become big brothers or big sisters to the dentists that train here, and they interact with the community, with the local Stark County Dental Society.
Our attendings are all either practicing or have practiced in this area. They have a ton of connections. They take us to all of their meetings and they involve us in everything. So I think that set me up immensely well.
Kent is kind of a hidden gem. It's a little city with a big city appeal. If you are a sports fanatic, you have every sport.
Everywhere you go, you feel welcomed around here. My first year, I had a whole class of just awesome people. They're my best friends. So I still hang out with them like every single weekend.
There is nothing that they will see in private practice that they have not seen in the residency. It prepares them for the real world.
It's supposed to be a difficult year. It's supposed to be a year where you learn a lot and you challenge yourself and you take time to build skills.
To see how the residents grow just in 12 months, from a dental school graduate to someone who's ready to meet the needs of medically complex patients, is really rewarding.